Nothing good happens in your dental life without this. My name is Paul, Dr. Nacho, and I want to share with you the thing that will help good things happen in your dental life at any age or stage. Case acceptance chips with Dr. Nacho, that is me. We're going to talk about the C's to more case acceptance success, because you cannot help a patient produce dentistry, help your team, pay your bills without case acceptance. We should be talking about this day one, D1 of dental school, and not stop until we are RADs, retired age dentists. Everyone gets how to do a crown prep eventually, but some dentists never get this: how to talk to patients, how to motivate people, how to do the things we love to do. So how can I help you with the C's to case acceptance success? First C is concerns. Say to a patient, can I share some concerns I have about your mouth, your teeth, your gums, your bite? Can I share a list of concerns? It's kind. You're concerned about the person. First C, can I share a list of concerns with you? Second C, conflict. Dentists are conflict averse, and talking to people about stuff they don't want to hear is conflict. Talk to people about vacations, hair, wine, coffee, chocolate, no conflict. People like that. Talk to people about new furnaces, saving in a 401k, doing dental care that they need. There's going to be conflict. Embrace the conflict and realize you are there to help patients. Embrace this conflict as a dentist, but dentists being conflict averse, people are going to say things that you don't want to hear. They're going to say things like, this is expensive. Are you trying to rip me off? That's okay. Develop your own system. I'm going to help you with this system with the C's, but it's important for you to realize, whether you're in dental school right now, whether you're a seasoned age dentist sad who's been a dentist for 25 years and think, why aren't patients doing more work in my office? A lot of the times because you are not embracing conflict and saying, this is going to happen when I walk into the room. There's going to be conflict. I'm going to need to know how to embrace these challenges, answer these questions. I'm going to tell you that with the next C. Compassion. Compassion is you sharing with the patient. You know it stinks to have to invest $10,000 in their mouth, but you believe in it. You value it. When you believe in what you do, whether it is doing dental care or selling nachos, when you believe that helps other people, your entire body language changes. And we'll have other episodes on case acceptance chips that talk directly about money, because dental school makes us feel very weird about charging patients money. I don't feel weird about it because we're helping these patients, but oftentimes we do not get a good money talk early in our career and we make it weird. So in future case acceptance chips, watch for that. We're going to talk about how to talk about money. Next C, confidence. Confidence is you. I have total confidence. I'm going to my dental office after this. I'm going to talk to a patient about a treatment plan that's over $10,000. This patient has numerous dental concerns, numerous dental issues, but I am totally confident that what I am offering to this patient with our treatment plan menu will help this patient more than it helps me. Listen to that again. What you are offering to the patient, it could be a night guard, it could be a filling, it could be a full mouth rehabilitation. That helps the patient more than you. I totally respect that they are investing money and time in it. But what I'm helping them do, chew with confidence, smile with confidence, eat food, be healthier. You cannot put a price tag on that. So your body language, you have to be totally confident, your team confident that what you do is helping the patient more than you. That's for anything that you share or sell in life. Confidence. The next C we have, not caring about this, not caring about this. This is my most golden Nacho tip. When I go to my office today and talk to a patient about a $10,000 plus treatment plan, I don't care about this. I don't care about it at all. The patient knows it because I'm totally genuine, authentic about it. I do not care what the patient chooses. I don't care. If the patient chooses the $15,000 option, great. The patient chooses the $5,000 option, great. If the patient chooses no option and not to order off of my dental menu, that's also great. So I don't care what the patient chooses. I care a lot. I care a lot caring about this, the menu I create, explaining the menu, going over the option, giving them a heads up on the good parts and the challenges. Informed consent, such a dramatic word. How about this? Heads up. Hey, I want to give you a heads up. If we do implants that snap in and out, heads up, you can clean them underneath the sink. That's a good part. One of the challenges is they can pop out versus ones that stay in all the time. Be confident, make it fun. So care a lot about your menu, don't care what the patient orders. I actually use this example. Hey, welcome to our dentisting restaurant. No one really likes to be at restaurants like this, but they help you eat at the restaurants you want to go to. You can make it fun. You're allowed to have a personality like that. Talk to patients like people, and magic will happen. Share, here's my menu of treatment options. Which sounds good to you at this time in your life? What fits into your life goals? I want to give a shout out to Mark Hyman, Dr. Mark Hyman, because I heard him speak as a young dentist, and that changed how I talk to patients. Also, Dr. John Coyce, which is great because he says patients do not accept solutions to problems they do not have. Dr. John Coyce, so we have to create these challenges and problems so they understand them. So just a couple more C's here before we jump off. So embrace the challenge. Make that fun. You like doing a class 2? Well, actually, no, they're fairly annoying. But you like doing full mouth rehabilitations? You like doing veneers? You like that clinical challenge? Well, embrace your case acceptance challenge. Work on your dentisting core. What's your dentisting core? Your hand skills, your mind skills, and your word skills. Hand, mind, words. Clinical, business, patient communication. Clinical, leadership, how we talk to patients. That's your dentisting core. Dental school overvalues the clinical part. It is so important to practice your clinical skills. But if you don't practice the other skills, you become lopsided. You become like someone who goes to the gym and just does bicep curls. They do not create a good dentisting core for success. So embrace that challenge. Now, at the end of case acceptance chips, okay, we're gonna have these case acceptance chips for you, digestible bites, so you can learn this and use this in your office. Use one thing. I want to say, here's one thing you can do right now. One thing you can do next. One thing you can do with the patient. And this is something I do all the time. This is something I've shared with dentists for years, and they always say it gets a good laugh. The patient enjoys it. They enjoy it and say this. So when you go over your menu, 20,000, 10,000, 5,000, 500, 200, 0, this is what you say. Look the patient in the eye and say, hey, even if you decide to do nothing, we can still be friends. Even if you decide to do nothing, we can still be friends. It diffuses the tension. It disarms the patient. It shows you as a person saying, hey, it's totally cool if you decide not to do anything. I do want to share with you, I do want to remind you the heads up on what happens if you do nothing. Pain, swelling, infection, bone loss, loss of chewing power, tooth falling out, tooth breaking. These are all things. But even if you decide to do nothing, we can still be friends. Those are magic words. It diffuses the patient. It disarms the patient. So I encourage you to work on the C's. Watch this video. Use it. You're not going to get it all. This has been a journey for me through my medium-aged dentisting life. And if you want to know about our next case acceptance program, we have exciting case acceptance programs at Dental Nachos to make you a happier dentist, a less stressed out dentist, a more productive dentist, have more fun in your office. Just text CHIPS to 215-543-6454 or email salsa@dentalnachos.com. Text CHIPS 215-543-6454, and we will text you our next case acceptance programs. And watch out more for case acceptance chips with Dr. Nacho. Have a great day, guys.